In a surprise move that could send shockwaves through global pharmaceutical markets, President Donald Trump has announced sweeping new tariffs on key imports, with the most significant being a 100% tariff on branded or patented pharmaceutical products, effective October 1st, 2025. Unless drug makers are building manufacturing plants in the United States, they could soon face massive financial penalties. On Truth Social, Trump wrote, and we quote, "Starting October 1st, 2025, we will be imposing a 100% tariff on any branded or patented pharmaceutical product, unless a company is building their pharmaceutical manufacturing plant in America." He emphasized that companies actively constructing facilities in the US would be exempt. That means it's not just about made in America, it's about built in America. This aggressive policy appears aimed at forcing pharmaceutical giants to localize production inside the United States, a goal Trump has championed since his first term. But pharmaceuticals weren't the only target. Trump also announced new tariffs across several consumer and industrial sectors. 50% tariffs on kitchen cabinets, 30% on upholstered furniture, 25% on heavy-duty trucks. The reason for this, Trump wrote, is the large-scale flooding of these products into the United States by other outside countries. He specifically noted that the truck tariffs are not just about trade, but about national security, citing companies like Peterbilt, Kenworth, and Freightliner as needing protection from what he called unfair outside competition. Let's focus back on the pharmaceutical sector. What exactly does a 100% tariff mean? Essentially, if a branded drug currently costs $1,000 in the US and it's imported from a foreign manufacturing plant, the tariff would double the cost, unless the company is actively constructing a plant on US soil. This could upend the pricing models of major pharma players like Pfizer, AstraZeneca, Novartis, and Sanofi, many of whom manufacture drugs abroad but sell them at a premium in the US. The pressure is clear: build in America or pay double. With only a few days until the October 1st deadline, companies face immense pressure to at least break ground on construction projects, or risk losing a massive share of US revenue. The impact may be felt most sharply in India, home to some of the world's largest producers of generic and specialty medicines. In 2024, India exported over $3.6 billion worth of pharmaceuticals to the US, and by mid-2025, that figure had already reached $3.7 billion. Companies like Sun Pharma, Lupin, Dr. Reddy's, and Aurobindo have built their business models around supplying affordable generics to the American healthcare system. Although the new tariff primarily targets branded and patented drugs, typically dominated by Western multinationals, experts say there's ambiguity around whether complex generics or specialty formulations could be swept into this definition. That uncertainty could create serious headaches for Indian exporters, especially if product classifications are left to customs interpretation. Unless clarified soon, Indian pharma companies may have to accelerate plans to build or expand manufacturing footprints in the United States, something only a few have explored at scale so far. Reactions to the announcement have been swift and divided. Supporters argue it's a necessary step to reduce dependency on foreign supply chains, especially after pandemic-era shortages. Critics, however, say the policy could increase drug prices for US patients, disrupt supply chains, and trigger retaliation from trade partners. The pharmaceutical lobby is expected to push back hard, possibly through legal challenges, appeals to Congress, or attempts to get exemptions. Meanwhile, international partners, including India, may raise the issue through diplomatic or trade channels, especially if their domestic industries are disproportionately impacted. With the 2024 elections now behind us and Trump back in office, his administration appears set on making good on America First economic policies. And the pharmaceutical industry is now firmly in its sights. So what's next for global drug makers and for patients who rely on these medications? That depends on how quickly companies can adapt, how clearly the policies are defined, and whether other nations choose to respond in kind.
Welcome to Money Control, your ultimate destination in the ever-evolving world of finance, business, markets, policy, and technology. India's preeminent news platform, driven by facts and fueled by data. A platform made in India, and for the world. Moneycontrol.com has a staggering reach of 100 million plus monthly active users and 6.02 million daily active users. Being a transformative digital force, reshaping how we engage with money, markets, and news. Setting us apart is our commitment to delivering accurate information and empowering financial decision-making in a dynamic ecosystem. Seeking a deeper dive into the financial realm, we present Money Control Pro, a powerhouse of exclusive insights, providing actionable investment ideas and expert analysis. Because in today's fast-paced world, informed decisions demand both information and expertise. And we have 1 million plus Money Control Pro total paid subscribers and 100% return in 1.5 years, beating the market. Explore market trends, access expert opinions, and utilize essential financial tools all at your fingertips. Join the millions who trust Moneycontrol.com for their financial journey, where facts meet finance and data drives decisions. Think markets, think Money Control.